Majin here with Dr. Davis. We are going to be doing a left piriformis muscle release to treat one of the most common causes of chronic back pain, which is piriformis syndrome. It's a torn piriformis muscle. It's a muscle located deep within the buttock, at the top of the buttock, and it's the second most common cause of sciatic pain. The first being a pinched or irritated nerve root by a herniated disc or spinal stenosis. Okay, our patient has bad scoliosis. She's had other procedures done for her back pain. This is one of the last things left. The fact that she has a left piriformis syndrome. We've done a diagnostic block. It worked. She's gotten great relief. Shot. Now the piriformis muscle attaches right where the tip of that device is. Can you show us? There we go. A little higher. Put the arrow. Yeah, shot. Okay, right there. See where the arrow is, Henry? That's where the piriformis muscle attaches, at the back end, the posterior facet of the greater trochanter. Henry, can you see it?
Yes, we do.
Excellent. All right, very good. So Dr. Davis and I are going to proceed with releasing the piriformis muscle. I think that's a perfect entry point. You don't want to be too lateral. You want to be straight over the greater trochanter or a little bit medial, so you can target laterally along the medial border. Now the nice thing about our procedure, and this was developed at Deuk Spine Institute, this is a minimally invasive. It's done with a 3 millimeter incision. It's outpatient surgery, unlike open piriformis release, which is done with the patient basically having a large incision on the buttock and a large cut through the gluteus maximus. Lots of dissecting and lots of mucking around. With this procedure, it's a 3 millimeter incision. It takes 15 minutes. And so far, every patient we've treated has had 100% relief of their pain. Let's see where you are. Shot. I wouldn't go any more superior than that. I would just feel the bone posteriorly and then slip around medially. You know what I mean?
Yeah.
Like if this is you dock here at the top half and just slip around and start boving and just do this as you feel the medial surface of the bone. Mm-hmm. And what we're doing is we're releasing the attachment of the piriformis muscle to the medial surface of the greater trochanter. And it's the posterior half of the greater trochanter's medial surface that the piriformis muscle attaches to. Do you feel a twang by any chance? All right. Now we've done 5 patients to date, and all 5 have had 100% of their piriformis pain completely gone with this procedure. As a matter of fact, one of them is coming back today for our second case, and he's already had one side done. He wants the other side done. He's so happy with the results. Unfortunately, I would go superior to that if you haven't already. And that's perfect for an inferior margin, in my opinion, Dr. Davis. I think from there up to the top would be really good, and I wouldn't go past the posterior cortex of the femoral neck. That's very nice. You feel muscle there? Yeah. Mm-hmm. I release it. So, nice. Here's the problem, folks. Piriformis syndrome, it turns out, is responsible for 35% of the secondary causes, the minor causes of back pain. 35% of patients have piriformis syndrome. That's a huge number. The most common cause of back pain, chronic back pain, is the disc. The second most common cause is the facet. That's perfect positioning. The third most common cause of chronic back pain turns out to be the piriformis muscle. It's so easy to damage this muscle. All it takes is bending forward and tearing the muscle. Let's get a lateral view. AP and then lateral. AP quick and then lateral. It's perfect position. I want to look down the femoral neck, or I want to see the posterior cortex of the femoral neck, wherever that is. So the piriformis syndrome, very common problem, and up till now our treatments have been therapy and injections, which really don't work very well. They don't last. So recurrent or residual piriformis syndrome is very common. People live with this pain for many, many years. All right, so you're pretty anterior, right?
Yeah, right now, yeah.
Yeah. All right, let's go to AP. I don't think you need to go that anterior normally. That's why the lateral view is good. I think you've gone more than you need to anteriorly. Shot? All right. Here's the posterior cortex. Shot. I'm sitting right on the back. And then if you just slip around medially, really it doesn't require going too far anterior. Feels like you've released it, which feels good to me. Shot. And by the way, the good news is there's no blood vessels here that you can really hurt. There's no nerves here that you can hurt. With this approach, the approach we're using. All right, we're done. Nice job. So we're going to do a staple, Luis, staple, and then tomorrow we'll get the staple out. I'm not even sure you need a staple. Luis, what about a steri-strip and a compression bandage? I don't think it's going to bleed much. Yeah, it's not like it's so super muscular like the lower back. So just to recap, can you see the incision, Henry? Let's show the incision. Do we have a tape measure? Henry?
Yes, we can.
All right. Look how tiny this incision is. It's about 4 millimeters. And we're going to use a Band-Aid. Let's get a nice picture, Henry. Tell me when you're ready. I want to use this for the website, okay? Tell me when you're ready.
It makes it longer when I stretch it.
Henry, you ready?
Yes. And one more second. Perfect.
Yeah, it's pretty much bloodless surgery. It's 4 or 5 millimeter incision max. And we'll do a pressure dressing. All right. So the problem with piriformis syndrome, very common cause of lower back pain, top of the buttock pain. Doctors don't have a treatment that's permanent. They do shots, they do therapy. It only lasts for a little while, then the pain's back again. So this is a permanent treatment for piriformis syndrome. It's called a piriformis release. And Deuk Spine Institute has pioneered a new way of doing it, and that is, we did it in 2023. It is a minimally invasive percutaneous piriformis release. It's called the Deuk Piriformis Release. And we just completed a Deuk Piriformis release on the left side of this patient. And we've had 100% pain relief in the buttock with each one of these we've done. We've done now, this is number 6, and we're going to write it up and publish it soon. So, nice thing is it's very safe. There's no major arteries or blood vessels in the area that we're working. Thank you.